Many eye lifting procedures really should be brow lifting procedures. And to be further specific, not necessarily what we might think of as forehead lifting or big incisions across the forehead, up in the hairline. There are a bunch of different ways of elevating the brow, but you don't necessarily have to lift the forehead. Well, why not lift the forehead? Lifting the forehead it's a tough recovery, and it's honestly more horsepower than most patients want. How many patients, as soon as I introduce myself to them, they say, I don't want to look like that. And they point to a picture of their friend who had an aggressive forehead lift and their eyes are wide open. It's too much, it's too startled. However, they also don't want to look like this other picture. And the other picture in eye lift surgery is the patient whose eyes are hollow, deep set, and have lost their softness. Most common reason for this is, well, obviously an over-aggressive blepharoplasty. Well, simply we don't need to be that aggressive, but it's usually a misdiagnosis. The patient not realizing what's going on with their eyelids, but oftentimes the surgeon not realizing it's actually their brow fat pad that is covering up the upper eyelid and leading to the appearance of age. So if you do a typical eyelid lift surgery, when the brow fat pad is low or drooping, what happens is the brow actually goes lower, and the eyelid becomes more sunken in and more hollow, and the eyelid looks more aged, and it doesn't function well. And when the eyelid doesn't function well, it gets thick, it gets red, and has a ruddy aged appearance. So how do we avoid all that? Oh, it's actually really easy. Any of the minimally invasive brow lifting procedures, and whether you prefer an endoscopic brow or through the eyelid, which I tend to favor, brow lift procedure allows you to elevate the brow fat pad above the brow bone, open up the eye, and have a very youthful eye, removing really just only the extra skin that's left over.